The Biden administration continues to insist that it's following the science while taking actions that run counter to the science. Earlier today, the Food and Drug Administration authorized booster shots of the Pfizer vaccine for 12 to 15-year-olds, and they did so by circumventing the standard convening of the Vaccines and Related Biological Products Advisory Committee. Why? Well, I don't think they liked what they had to say. Now, is the Biden administration really being driven by the science? The whole response to this COVID, the various variants, is it being driven by the science, or is it being driven by something else like fear or politics? Here with me now to talk about this is Dr. Andrew Bostom, an academic clinical trialist and epidemiologist who is currently a research physician at Brown University Center for Primary Care and Prevention at Kent Memorial Hospital in Rhode Island. Dr. Bostom, welcome back to Washington Watch.
Thanks for having me on. Happy New Year, Tony.
Thank you. Happy New Year to you as well. Let me first get your reaction to the FDA's authorization of the booster shots for 12 to 15-year-olds. What do you think about it?
I think it's very misguided, and I think there's been some strong dissent. I think members of advisory panels have literally resigned over this issue. Tony, we're on very flimsy grounds in terms of vaccinating children to begin with the primary series, the typical two-shot mRNA series that was initially approved. That was based on a very small trial of 2,300 kids. Now, that may sound large to some people, but it's actually a very small trial, where they literally prevented, comparing the placebo group to the actively vaccinated kids, they literally prevented in these 5 to 11-year-olds 13 cases of sniffles. There were no serious cases of COVID in either group. There were certainly no hospitalizations in either group. That's a pretty flimsy basis to go and embark upon a mass, vaccination program, particularly now, Tony, when we're seeing what's developing with Omicron. I just saw an enormous analysis from a electronic medical record database of 84 million Americans, which showed that in kids in the pediatric age range, so newborns to 17-year-olds, this analysis of the Omicron period, comparing it to Delta, showed that kids in that age range are running about 4 to 5-fold less rates of emergency department visits and about 2 to 3-fold less lower rates of hospitalizations with Omicron. So that's against a background of extremely limited disease, certainly in healthy children, to begin with. It just the whole thing, the whole rush seems unnecessary. The Omicron itself, given this sort of light disease burden, may confer and its contagiousness may confer a much more robust and long-lasting immunity than any vaccination, than boosters. And not as if you're, again, particularly with the mass of kids who are healthy, you're not subjecting them to an unreasonable risk by just letting it spread in the community.
Well, and you're the expert on this, so let me ask you this question. When you have the natural immunity, is there more elasticity to the different variants that may come that way as opposed to a specifically targeted vaccine?
It does appear that way, Tony, because of the robust nature of T-cell, of cell-mediated immunity and its great adaptability, whereas antibodies, tend to be much more specific, can wax and wane. I mean, there are memory B cells that are antibody producing cells that can confer long-term immunity as well. But it's really the T cell immunity that appears to be much more robust from natural infections and much more flexible.
Right. So if we really wanted to stop this and build a bulwark, a firewall, if you will, around society, it would be probably a quicker way to do it is allow healthy people who may get the Omicron virus or variant to get that natural immunity. I think, wouldn't we reach that goal of herd immunity quicker that way?
Yeah, and I mean, look, the bottom line is they're going to get it. I mean, it's breaking through the vaccines, even the boosted populations across the world, Africa, Europe, and now the United States. So it's spreading, regardless of whether we put our stock in the vaccines or not. And so, yes, given its relatively mild nature, we have an historical precedent perhaps for this. There was something that circulated between 1889 and 1891 called the Russian flu. It turns out that it was likely a coronavirus which jumped from cows to humans. It was a very aggressive disease initially. Now, with genetic analyses, it's believed that became a common cold-causing coronavirus, which now circulates as human coronavirus OC43. This is a cold-causing coronavirus, which occasionally can wreak some havoc in a nursing home setting, but by and large circulates, amongst children and adults as a cold-causing coronavirus.
Well, let me ask you this as the last question, as an expert, as a physician, as one who is concerned about these things. Is it not troubling when we see the federal government taking on an issue that's already plagued with uncertainty in the eyes of the American people to violate both the process and the science to get to their ultimate objective?
It's extremely troubling. Again, it harkens back to the very bad Lysenko era in the Soviet Union, where this geneticist somehow became the favorite of Stalin and imposed his views on the scientific community to the great detriment of Soviet society, of the ordinary people back then, and contributed to famine and to the debasement of science.
Because next time something pops up, people are going to be more distrusting of the government, even more so when the government violates its own policies and it ignores the very thing that it says it's following, and that is the science. Dr. Bostom, always great to talk with you. Thanks so much for joining us today.
Take care, Tony.